Do you have any advice for how someone with long COVID should approach their family physician for treatment of their mental illness?
Yeah, I mean, I think, and this is maybe for both sides, for the medical practitioner as well as the patients, like really from a place of collaboration and the mindset that everyone's doing the best they can. I've seen a lot of frustration and tension because everyone's just overwhelmed and no one knows what to do. So, patients come in because they're scared, they read about this, they're hoping for care, and then they feel disappointed if their doctor doesn't know what to do. And then the doctors on the flip side want to help, they're healers by nature, and then they kind of get stressed and maybe distant even if they don't know what to do. And they're kind of like, this isn't a thing I've heard of. So everyone's struggling. So I always say, like, kind of approach from this place of, I'm experiencing these things. Can you help me, figure out, what's going on? Or if there's any parts of this we can do something about. Because I think that's the part that's really hard, is the chronicity and the complexity of this, is that we may identify things and there still may be a long road to recovery. And so it's not really about finding the fast answer, unfortunately. It's about just figuring out, let's rule out big, scary things. Let's identify, rule in or rule out things we can intervene on. Like, have you developed a new, like, lung condition or heart condition, or do you need physical rehabilitation? And then we have to really be comprehensive. So for the patient too, knowing that the treatment plan to get back may be pretty comprehensive and very rehabilitation focused as opposed to like cure focused,
Mm.
and then knowing that it's a process. And so, and then, yeah, you can ask your GP or family doctor, do you know of any place where I can get like a second opinion or a consultation? And then we can continue working together on how to manage this.
Do you have any advice for family physicians on how to manage mental health amongst long haulers in the community, and when not to initiate medication?
Yeah, so sort of the flip of what I was saying earlier, but I think it's really about, again, you have a lot of training in mental health, and so don't be, I don't want you to feel like you don't have what it takes to treat long COVID. But I think, again, it's really about figuring out impairment. If you're unsure of the level of impairment, are there objective ways to test for that? So you don't want to jump straight to like neuropsychological testing. That's a very limited resource. But if you have someone who was like maybe previously a doctor doing ER shifts and now they can barely manage their bills, and you're trying to figure out, can they go back to work, or figure out why is their impairment so significant? They had COVID for 1 week, then that might be a time to seek out additional ones. Again, but if someone's on the road to recovery, I think that's okay. You can just be there on the journey with them. You don't have to seek specialty care. So I really think that's the kind of thing. What is the trajectory of recovery? What is their level of impairment? And the same thing for initiating mental health treatment. What is their level of impairment? Are they getting better? Are they not? Is their mental health contributing to other parts of their care, which we know it does. So if they have brain fog and depression and anxiety, you want to optimize treatment of the depression and anxiety, not because you expect that to fully cure the brain fog, but it's going to help, right? So that kind of thing is like, is the mental health symptoms or conditions feeding into other parts of kind of that whole picture? And I think, again, kind of leaning heavily on resources like this to try to make sure you're doing this level of workup. And then once you've exhausted it, then you'd be like, okay, I need someone else with new ideas to kind of come help us out.